saw her on a Friday afternoon, what did your shift, excuse me, I'm sorry, what did your shift consist of on that Friday?
So my shift on the Friday, usually I end at 5 p.m. is when we do our sign up for the night team. So if you can say she got to our unit about 3 or 4 p.m. So it's towards the end of my shift. My shift consisted of coordinating, getting as much information as we could, coordinating and making sure that the right people were involved in her care and created a plan for specifically the most immediate plan, which would be that evening and night, to get her stable during that time.
And when you say you developed a plan, who did you develop it with?
The pain team, which was Dr. Jenny Dolan, and the ICU team. I believe Dr. Dolan spoke with other members of the pain team during that time as well.
And what was the plan at that point?
So the plan was to stabilize Maya and make sure that she wasn't at the level of suffering that we were seeing. And included the medications that I just stated, which are the infusions of ketamine and Precedex, propofol during that first night for a specific amount of time. I believe we said 4 to 6 hours. And then, if able, if there's still significant concerns of her abdomen, at some point getting the CT scan.
Okay. During all this discussion with the mother and review of what had gone on, did you receive any information regarding what ketamine or what other drugs the patient had been taking?
Yes, the mom informed me of the medications that she was taking outpatient. Not all of them. There was like vitamins and things like that, but mostly the ketamine treatments that she was receiving. She did mention that she was a patient of Dr. Kirkpatrick and Dr. Hannah, and that she would go regularly to get, depending on where her, exacerbation of her pain was, to get these infusions of high doses. She told me all the doses of the ketamine to kind of, in her, kind of explanation was to try to break that pain. She also mentioned that she had been to Mexico for I believe was a week, where they did an infusion of high dose ketamine, and that she was intubated during the time. And that at this, on our admission, she was asking me to please start those medications, the ketamine at those doses, and that I needed to intubate her, that we had to intubate her and do the whole, kind of a week or whatever, how many days it would require, because that's the only thing that would take her pain away.
During all this exchange, were you given any indication of what the diagnosis of this patient had been at Lurie Children's Hospital?
No, she did mention that she went to Lurie's at some point within the last year to Chicago for a second opinion, and I believe it's in my HMP as I try to summarize everything. But that she went there, she didn't really tell me what the diagnosis was.
Okay. And with respect to Tampa General Hospital, were you told of her being evaluated there or what the diagnosis may have been?
She also said that she went to Tampa General. I don't believe she told me in details. I don't recall that, and it's not in my records.
What were you told regarding what the patient's diagnosis was?
She said that her diagnosis was CRPS, but that it was all in her entire body. Manifestations were in her entire body. And then she also said that she had a history of asthma. For what she went into all the details of prior asthma or coughing visits to the ER, to the pulmonologist, which I then went to the records to, because some of them were in our institution.
Were there, now this was in addition to the abdominal pain that she was
in addition, yes, sorry.
And did you arrive at any well, let me back up, Matt, just ask a question this way. Who was it that was undertaking to manage the patient's pain medications?
During our admission or before? During our admission?
At this point in time.
It was, I seek guidance from the pain team, and they would tell me the plan with the medications. And then my job is making sure like the rest of her organs and everything else is stable. So I would look at their plan from the pain standpoint and just make sure that I was monitoring the right things for the medications that were being utilized.
Did you call for any other consultations besides just the pain team?
That first day,
Yes, yes, ma'am.
consultations, I don't believe. Oh, yes, we did. I talked to the mom about, she expressed a lot of level of stress. And as part of my basic knowledge of chronic pain, we always know that there's a psychological stress that probably needs support with counseling. And so I did offer and told her that we were going to consult our psychiatrist.
Okay. And were there other consultations ordered as well?
Not that that day we did not communicate to the family of any other consultations.
And was the psychiatric consultation
Conducted? No.
Why?
The mom didn't feel like she needed that.
Okay. So
I believe actually the psychiatrist came. Sorry to interrupt.
Okay.
But the mom didn't want it.
Okay. So what was the diagnosis upon admission to the PICU as far as you were concerned?
Yes. Let me just refer to my notes for a second. So in the ICU, we have chronic diagnosis and acute diagnosis. The chronic is pretty much relating to the history. So it's complex regional pain syndrome, and the second one is mild persistent asthma. But our acute diagnosis at the time were acute generalized pain exacerbation and abdominal pain.
Okay.
And there was a notation of constipation seen in the X-ray that was obtained for the belly.
Okay. And let me direct your attention to your note.
Mm-hmm.
Now, instantly, you wrote what's called a history and physical?
Yes.
Okay. Would you explain to the jury what that is?
So that is basically the initial note that does a summary of the presenting, like the HPI, which is the story of the acute event that brought the patient to the hospital. And then it goes very systematically and organized into all the elements of the history, being process hospitalizations, surgeries, any medications that the patient usually takes, any prior diagnoses, any social exposures, developmental, especially in pediatrics, we like to talk about, where they are developmentally. Then we go into the review of systems. Then we go into any labs that are available that are pertinent to that admission, any imaging studies. And then we go into our assessment, which include our, we call it problem list, like our diagnoses, and then our plan by systems as well.
Okay, so I'm going to ask that 1001 dash 31 to 38 be put up. And Your Honor, that's in evidence as part of the All Children's Hospital chart. And that begins on the bottom of this page, I believe. And let me ask to scroll over to the, and we're going to publish this along with the Dr. Smith's records in a few moments here. But I'd ask for this to scroll over to the plan portion of this. And I'll ask you, Dr. Tepa-Sanchez, what was the plan for this patient upon the patient's admission?
So the plan was to closely monitor, as we do on all our patients in the ICU, that we had consulted the pain team and we continued communication with them based on the complaints of pain. We created that plan, which is detailed there in number 3 of the medications that we were going to utilize and what doses we were going to start the medication on. And later in that paragraph, we had already discussed that treatment would go over for at least 3 days to make sure that we have her under, a much better control of her pain for those 3 days before considering any type of weaning. We explain all this to the family as well. I do put a notation in there. We like to anticipate in the ICU so that if for some reason she required higher doses and that our team decided to do higher doses, that we express to the family that at that point the risk of respiratory failure or any type of cardiac, pathology could arise, and that she might need to be intubated. Then I did consult social work. I also consulted psychiatry, so that's part of the plan. As a multidisciplinary team, we wanted to evaluate all the possible causes of suffering for Maya. And at some point, mom, had kind of agreed, but then once the physician came, she denied it. We will continue to do neurological checks based on her mental status, depending on the doses of the medications. For that night, we did not want to let her eat. We did put her on IV fluids to make sure she was hydrated. And the reason was because we don't ever want to, if we have to intubate a patient, we don't want any food in their belly because they can vomit and then aspirate. And then we did prescribe things like Zofran, which is for nausea. We knew that there was a concern of constipation, so we were just going to closely monitor that for now. We didn't want to give any medications for that because we didn't want to put anything in her belly just in case. I have the abdominal CT still within my plan to be performed at some point to obtain a urine analysis to make sure she wasn't having like a UTI that was causing her the pain. SCDs that basically are like these compression devices on the legs to prevent any type of clots. We do that a lot in our ICU. And I think that's it.
Okay. Now, before formulating that plan, had you gone back and looked at the records of All Children's Hospital for the patient's previous admissions and encounters?
Yes, as much as with the time, that I was there, I did as much as I could to look at notes from before, especially to create this document because I wanted to make sure everything was coherent.
Okay, and in doing that, how many records did you review? It looks like there's several pages here.
Yes, I went through, mostly what I recall is going through like the prior ER visits to our ER. There were notes from consultations and follow-up visits with the pulmonologist as well. Those are the ones that I recall the most.
Okay. Now, was there any issues that you had with Mrs. Kowalski regarding the amount of medication that was being given?
Her initial requests were of really high doses. So I don't know if when you mean issues, like more of that discussion that we had, that I was not comfortable given those amount of doses. I had never, I think, gotten anywhere close. And that was definitely out of my wheelhouse. So I did mention to her that I did not feel comfortable doing that I was consulting with the pain team as the anesthesiologists that deal with this type of kind of chronic pain type of patients. So it was a back and forth on the dosing. Like we would come and create a plan, and like we're going to start the ketamine at, I usually start at like 0.5 milligrams per kilo or 1 milligram per kilo, but for different reasons, not specifically for pain. With the pain team, we came up to 3 milligrams per kilo is where we were going to start. The doses that we been requested were more like 10 milligrams per kilo. So there was a back and forth on the dosing of what we were going to do. Was
the pain team taking primary responsibility for taking care of the pain medication and
yes.
pain management? Okay. And did you have any exchange with Mrs. Kowalski about her level of stress and Maya's level of stress at that time?
Yes, I recall during that time when we sat down and kind of were able to have more effective communication. She did express how stressed she had been. I believe I also note that on my H&P, on the HPI part. She was saying that this had been, a really rough year for them, and that she had been very stressed. She did mention that at times she just felt like she just couldn't do it anymore, and that either her and Maya as well were very stressed and thought that, that at times she just wanted to die. She also said, and I put it in quotes, that she just wanted to go to heaven.
Okay. Now, did you offer to assist Mrs. Kowalski about that?
Yes. After that was said, we continue our discussion. I asked her if she had a support system that, that we could definitely consult our psychiatry department for Maya, and that with the social work we can get counseling for her and kind of get her resources at this moment. And she, when I said that, she said, no, well, I'm okay. I'm okay now. I'm not thinking about that right now. So then I told her, I offered, like, if she ever needed, help to try to find resources, or if she needed, if she was having more trouble, that we could help try to find people that could take care of her. But definitely for Maya, that even more reason to get psychiatry involved.
So you couldn't take care of Mrs. Kowalski, but you were
Mhm.
offering to do so for Mom.
Yes, but I did offer to get her resources and, kind of names of where to go for her.
Do you have any other recollection of what occurred on this Friday, on October 7th, 2016?
No, my recollection is more of personally, I wanted to make sure that there was a consistent plan that we would all follow with all of our team. I usually, like I said, I usually sign out to the night team about 5
Claritin provides powerful allergy relief. Plus, it won't make you drowsy like Zyrtec can.
But that day, because of all the coordination, I actually probably end up leaving the unit or the hospital about 8:30 p.m., which is way past the
Okay.
usual time.
At the time, well, now you were seeing the Kowalskis the following day, is that right?
Yes. So then I took care of them for Saturday during the day. Usually a day starts at 7:30, and then ends at 5. And Saturday and Sunday. I believe on Sunday, because it's a weekend, sometimes if there's not like a lot of like critical patients, or we're not getting a lot of admissions during the weekend, sometimes one of us leaves early. So I believe I left a little bit earlier than 5 on Sunday.
On Sunday.
Mhm.
What about on Saturday? Were there any new developments on Saturday when you took care?
Yeah, so during the Saturday, we basically just continued our plan. At that point, I had kind of like the sign up from the night team and some of the more events from the exposure of taking care of Maya from nurses. And after reviewing the all the notes that I had, I had some questions in my mind that were not clear. I had questions about a lot of like the home therapies that Mrs. Kowalski had mentioned, that she was doing like IV fluid infusions at home, that she would do them herself, and also IVIG. And so when I went into a lot of
You may continue, Mr. Hunter.
Mr. Hunter, did there come a point on that Saturday, well, we approach Sean. So
Hello, everybody. I was on silent. So yeah, this is take care of my trial, and I guess from my understanding, the next witness is Dr. Beatrice Sanchez. So I think that's going to be interesting. And if you don't know the plaintiff, they have rested and defense is up. Hey, beautiful Sandy girl, how are you? Thank you for coming through.
You can continue, Mr. Hunter.
Thank you, Your Honor. On Saturday, October 8th, did there come a point in time at which you called Dr. Sally Smith?
Yes.
And did you call Dr. Sally Smith as a consultant?
Yes, I called her to ask her questions.
Okay, thank you. You had questions, just answer this question, yes or no? You had questions in your mind, so you called her.
Yes.
Okay. Did you continue to see the Kowalskis on that Sunday, October the 9th?
You're welcome.
Yes, mainly Saturday and Sunday, it was Dad that was there mostly. I did communicate with Mom over the phone.
Okay. And what, if anything, about the treatment plan changed on Saturday and Sunday?
Not much, to be honest. During the night, we did the propofol only the first night. So the only thing, we continued the ketamine infusion. It had gone up on the dose a little bit by that Saturday, from 3 milligrams per kilo to 5. It's my understanding after reviewing my records. We did not do any more propofol during the nights. And I believe that Saturday night she got the CT scan, which we didn't have the results yet by the time I was there during the morning on Sunday.
So by Sunday, was there a plan made to wean Maya off these medications?
So there was starting the discussions that on Monday we would start the wean process, I believe.
During that weekend, were the pain team continued to see Maya?
The pain team continued to see Maya, yes.
And did they continue to monitor her pain medications and her pain level?
Yes.
Did it appear to you over that weekend that you were able to make Maya comfortable?
Yes. She was not anywhere near the state that she had been on that Friday when she came to us. And then I believe on my note from the Sunday, the 9th, after a sit down with Dad and then Mom was on the phone, Dad did express that she was at a better state that Sunday and at a better control of her pain.
Okay.
And I documented that on my notes for Sunday.
Okay. On Sunday, did it come to your attention that the family wanted to transfer Maya?
No. Up to the time I was in the unit, they did not tell me. Oh, transfer, yes. Sorry.
Okay.
Transfer, yes. They didn't say that they wanted to leave. But
And what did you attempt to facilitate a transfer?
yes. The process, especially during the weekend, can be a little bit, kind of complicated. But I did call Nemours and started that process to be able to get connected to the physicians that would be able to accept Maya and transfer.
And were you able to reach anybody on that Sunday?
Not just the transfer center from Nemours. I did not personally speak with any of the physicians at Nemours.
So were you able to do anything in terms of facilitating the transfer that weekend?
I just initiated the process, but I personally wasn't able to do anything past that.
Okay. Now, you were on, we talked about October 7th, Friday, October 8th, Saturday, October 9th, Sunday.
Mm-hmm.
Who did you hand over to, so to speak?
So that Sunday evening or early nighttime, I contacted Dr. Michelle Smith, who was taking over for that Monday. And
And-
then whatever time I left the hospital, I signed out to the doctor that was staying.
And who was the pain team that you worked with over that weekend?
Mostly Dr. Jenny Dolan is who I recall with her nurse practitioner. It's who I had my direct interactions that I recall.
Give us what you're on.
You may.
And here we go again. So I hope everybody's having a good day. Do you guys know what that drug is that she was on?
Two other matters. During the weekend, during this weekend, was the diagnosis CRPS from an outside physician?
Yes.
And you also had concern about pain all over and abdominal pain? Correct?
Yes.
So the protocol that was being used for pain control over the weekend, did you and the pain team discuss that with the parents?
Yes. Several times.
And did they indicate to you they were in agreement?
Yeah.
After October 9th,
Mhm.
did you have any further contact with the Kowalski family?
No.
Were you ever involved in Maya's care after that date?
No.
Thank you.
So, okay, ketamine is like a anesthesia drug. And I think they're trying to put it out there that she was addicted to it. I don't understand the drug, so I can't say one way or another.
No questions. Members of the jury, do any of you have? Writing.
Do I need to go?
Do not discuss this case amongst yourselves, do not do the investigation, or do not information.
All
Yeah.
right.
You can step outside as well.
That was weird. I looked away for a minute. Was she crying? Did she grab a Kleenex? Looked like somebody was crying. I don't know. I know, right? I don't know anything about it, so I'm not going to speak on it, but I will research it. You know what I mean? But the impression I get, what defense is doing, saying that
Jury's out of our presence. Dr.
Oh.
Tepa Sanchez is out of our presence. First question. In your testimony, you mentioned, quote, die, end quote, and, quote, go to heaven, end quote. One, may you please clarify who made these statements? Two, said within the same interview or over different meetings / conversations? Three, are these observations clearly recorded in the J. Hatch medical records? Four, are the records that would document these statements entered in evidence? Four, you testified you communicated with Dr. Sally Smith. What date and time? What documentation of, quote, contact was it in an email or medical notation in paper files or verbal with a written follow-up?
Just double check the question on that. That's right. It's narrow enough.
Yeah, four is fine.
Any objections from anyone?
The four on the back is fine, and then there's the four up here. Which, I don't think we can answer.
So all those are okay? Next one, red number 2, Dr. Tepa Sanchez. To a patient, entering the ER can appear confusing when in fact it can be a highly orchestrated flow of events by many staff members to assist in the best care for the patient. 1, how long did Maya spend in the ER before being transferred to the PICU unit? 2, when Maya was transferred to the PICU unit, was the mode or the mood of Maya and parents at a more even / calm level, or was there still a flurry of confusion?
No objection.
Yeah, we don't object to the two questions, Judge, to the inquiry.
Yeah.
My partner says we agree.
That sounds like I think that's what, 2 agreements today? 3?
Unbelievable.
So I will not ask the introduction. That's 1. Okay, red number 3. Did you discuss with Dr. Michelle Smith that the family wanted to leave AMA? Why was the family not able to leave AMA? Isn't it protocol to chart in your charting the end of your chart being discussed with family or parents?
No objection.
Red number 4. If someone tells you they want to go to quote heaven, end quote, or quote die, end quote, did you report that to anyone to see if she needed to be placed on a psych hold if she is threatening that she wants to die? Could you have not called the police or security if you had concerns she was going to harm herself? That's red number 4.
It's okay.
Red number 5. Did the ER Dr. Behar Posey doctor mention to you or the admitting doctor her concerns of possible child abuse that she testified about in her testimony? Do you have that documented of the back and forth of the ketamine dosages of compromising the 1 milligram per kilogram to the 3 milligram kilogram? Will the jury get to see that?
Hang on.
I think the first question is dangerous. It invites a chapter in response.
I think, yeah, we're gonna have to object to number 1, 2.
I think you're safe on number 1, but I don't want to tell you that.
Number 2
Number 2
seems okay to me. But number 1 is gonna get us into, it's gonna open up me having to ask questions.
Do we have immunity for this call, Your Honor? Because if we do, I think it obviates the question. If we don't have immunity for this call, it might be submitted anyways.
Well, the first question is the statement by the ER doc to depict you. And so it's just a question of knowledge. If
I
I,
don't have any problem with it. I don't think we're gonna get in trouble with it, but I don't want to be held to that. I think I know what you're.
Nice. Now you know my problem.
is this something that I could preface it with a yes or no answer?
Sure.
Did the ER
That might be
doctor?
the safest thing to do.
Yeah, I guess you could say that.
And otherwise, we're okay.
I guess so.
Red number 6, on October 8th, why did you call Dr. Sally Smith as a consultant and not call the child abuse hotline? Did you not feel you had enough evidence for child abuse? Correct me if I am not correct. You could have just made a call to the child abuse hotline and not call Sally Smith to get started with CPI.
Yikes.
We all know that the reason is that there was a previous call screen on October 7th. So, again, it's a dangerous question.
She knew that a call had been made. She didn't know the outcome.
Oh, okay. Well, inviting her to speculate what the outcome was would also be.
No, she doesn't know.
Yeah.
She'll say she doesn't know.
Okay, so she doesn't know what the status was. I think it's dangerous.
I think Danger Will Robinson is in order here. Not that we're lost in space,
You
but
just dated
For all
yourself.
this,
there's a brand new episode about 5 years ago on
I just
Netflix.
told you about that. The robot. Nature, well,
Yeah. What do you watch on Netflix?
Take care of my.
Actually, I watched Darkest Hour.
no, it's the robot. It's the international sign for flailing.
So I hear there's an objection to this set of questions. Is that correct?
Yes, Your Honor. I think
Okay, I'm going to sustain.
probably not a good
Okay, so we'll not ask that one. Next question, red number 7. Was Maya dehydrated prior to arrival? Did you identify her nourishment level? Please describe, quote, SCD, end quote, for prevention of blood clotting. Was this from Beata or without Beata's mentions? Your administration of ketamine sounds incremental, moving slowly and methodically up from there. Yeah, methodically up from there, period. Identical to Dr. Cantu and his, what is the reason dosing of ketamine is done this way?
Something about titration. No objection.
Well, other than the comment about Dr. Cantu's testimony.
It's fair. She raised it with the Mexico stuff.
It's one juror informing the other jurors with their understanding of the testimonies.
Yeah, but it derives from the actual note where the Mexico treatment is discussed twice.
It's still editorial comment.
Well, I think the phrase identical to Dr. Cantu and his, I can strike that out, but then leave in the question, what is the reason of dosing of ketamine is done this way? So I will strike that clause and then ask the question. Okay. From a timing perspective, we're at 11:30. Remember, I've got to,
I'll wait 10 minutes for this.
I'm sorry.
Probably get 10 minutes.
Yeah. Okay, so do you want to just take lunch when we finish? Bring in the drink, please.
I have no idea. See, what I do, I turn the volume up on my monitor. Otherwise, you really can't hear it that well. Who knows if they know? Okay, this is really sad, this case. It's horrible that her mother took her life, but look at how easy it is to take your kid from you. Believe me, I know stories.
Okay, welcome everyone. Please be seated. Members of the jury, I want to confirm while you're away, you did not discuss this case amongst yourselves. You did no investigation and received no information. Is that all correct? And while you were away, you watched all sorts of media accounts about this case. Isn't that correct? And did you talk, or did anyone approach you about this case? Okay. And just to let you know, as you saw Dr. Tepa Sanchez walking in, I went over these questions outside of her presence with the lawyers. We're going to be able to ask most, but not all of them, but most of the questions we can. Dr. Tepa Sanchez, in your testimony, you mentioned, quote, die, end quote, and quote, go to heaven, end quote. May you please clarify who made these statements?
The mother.
Were these statements said within the same interview or over different meetings / conversations?
That was on the first day, on the 7th, when I sat down with her on the couch to get all the history and just kind of try to bond with her.
Are these observations clearly recorded in the Johns Hopkins All Children's Hospital medical records?
I'm going to quote my note and read. Mother states that she is extremely tired and is very stressed and at times feels like she wants to die, unquote. She also expressed that when Maya is in so much pain, she has also expressed she wants to go to heaven, unquote.
The next question, are the records that would document these statements entered into evidence? The answer to that is yes. The next question, you testified you communicated with Dr. Sally Smith. What date and time?
I communicated with Dr. Sally Smith on the Saturday, I believe was the 8th. And that was, I don't recall exactly the time, but it was probably after my morning rounds, after seeing all the patients.
Okay. What documentation of this contact? Was it in an email or medical notation in the paper file or verbal with a written follow-up?
It was a phone communication.
The next question. How long did Maya spend in the emergency room before being transferred to the PICU?
I honestly don't know.
When Maya was transferred to the PICU, was the mood of Maya and her parents on a more even / calmer level, or was there still a flurry of confusion?
It was, the mood in the room was very chaotic in the PICU. There was a lot of screaming and words that I won't say here, but just very kind of aggressive at some point.
Okay. Now, this next question changes this, Dr. Smith. Did you discuss with Dr. Michelle Smith that the family wanted to leave against medical advice?
No, because up to the time I was there on that Sunday, that was never brought up. The transfer to Nemours was what we were focused on, but I was never told by the family that they wanted to leave the hospital. So I didn't communicate that to Dr. Smith. Michelle.
So the next question, if you know, why was the family not able to leave AMA?
I don't know because I wasn't there.
The next question, isn't it protocol to chart in your charting at the end of your charting discussions with family or parents?
Yes, usually if there's a sit down, we do do a little bit more detailed charting, and it's on my note from the 9th, my progress note from the 9th. There is a summary of my discussion that we had. We call it family meetings, where we sat with Mr. Kowalski. Ms. Kowalski was in the meeting over the phone on a conference call type of thing. The pain team was there and all the ICU team, and it's recorded in my note.
If someone tells you they want to go to quote heaven, end quote, or quote die, end quote, did you report that to anyone to see if she needed to be placed on a psych hold if she is threatening that she wants to die?
So I definitely consulted the psychiatry that we have available at All Children's for Maya. And when I started going into with mom about, you know, a little bit more questions of how she was, she said, right now I'm okay. I have my family. I'm okay. I don't have those thoughts right now. So I said, you know, we have counseling. Please communicate to any of us if you're struggling. So I did. That's what I did.
Could you have not called the police or security if you had a concern she was going to harm herself?
At that point, I would have probably contacted our social worker and kind of asked what the proceedings would be if we had significant concerns on mom, if she needed to be Baker acted, which is what usually we would do. But she was not my patient. She was the mother of my patient. So, you know, my involvement on how to proceed with that, I would have to seek guidance.
Now, this next question, if you can answer with a yes or no answer.
Sure.
Did the emergency room doctor, Dr. Behar Posey, mention to you or the admitting doctor her concerns of possible child abuse that she testified about in her testimony?
No.
Next question. Do you have the document or that documented of the back and forth of the ketamine dosages of comprising the 1 milligram per kilogram to the 3 milligram per kilogram?
I'm going to check my records. From my HPI, I do say she states that at this point she's having a crisis and needs to be placed on an induced medical coma in order to break the pain. And then on my plan, I just state the final doses of what we had agreed on to actually give Maya.
And for the attorneys, these records are in evidence, right?
I'm sorry.
Yes, yes, yes.
Okay. So there was a next question is, are the jury going to be able to see it? Yes, these are in evidence. Okay. Next question. Was Maya dehydrated prior to arrival?
By the time I saw her, she had already received some therapies in the ER. So I did not appreciate like severe dehydration.
Did you identify Maya's nourishment level?
I did see kind of on my initial impression that she looked very thin. And, you know, we kind of follow the weight. I did consult, I believe, well, it's standard of care. All of our patients get a nutrition evaluation. I honestly don't recall if that was done that day or in the next several days.
Okay. Please describe, quote, SCD, end quote, for preservation of blood clotting.
So-
Was this from Beata or without Beata's mentions?
Most of our patients that are a significant size can get this. They're like a pneumatic, almost like socks. They compress your legs. to prevent blood clots. So almost all of our patients that are in the ICU, we discuss every day if they need any type of blood clot prevention. These are the least invasive. There are medications that you can get for preventing. These are the least invasive that are most effective. And some patients actually like them because it's like a massage on their legs, especially for the patients that are immobile and things like high risk, like having a central line or a port. Would put you at a higher risk. So we have our quality list that we go through every patient when we do rounds in the morning. And we go through all of this list to make sure that we discuss this with every patient that we round. And then her, you would see that that was initiated because she was at a higher risk.
Your administration of ketamine sounds incrementally moving slowly and methodically up. What is the reason of dosing of ketamine is done this way?
So initially, like I said, what I'm used to prescribing ketamine are lower doses. So we started at the 3 milligrams per kilo per hour. Overnight, the night team, because of whatever concerns and pain, they actually did go up to 5 milligrams per kilo per hour. So usually we go by how the patient's responding. As we had gone up, make sure the vital signs and everything, all the organs are stable. And I believe that was the highest dose we provided her, at least during the weekend.
Okay. That completes the jury's questions. Mr. Hunter.
Thank you, Dr. Tepa Sanchez. Let's start with the last one. You said that you had gone up, that's over the night, they had gone up to 5 milligrams per kilogram per hour. How long was that in place? Do you remember?
The 5?
Yes.
I believe by the time I got there in the morning, that Saturday was still at 5.
Okay.
And I did not titrate it lower or higher for that Saturday and the Sunday. So the whole continuous time.
Okay. And did you have an understanding about whether they were weaning down after that, from that point?
I have an understanding that after that point, we agreed, and it's on my notes, that would be the max we would do. And then by Monday, it was going to start being weaned.
Why was that the max?
Well, it was at least way above what I was comfortable. We were really concerned about any side effects. And at the time, she seemed to be calmer. So we didn't feel like there was a necessity to go up and get closer to that risk zone if she was calmer.
You mentioned that there was, that there were SCDs, and I can't remember what the acronym means.
Honestly, I can't either.
Something compression. something.
Compression dressing.
These are basically compression socks?
Yeah. Well, yeah, they're mechanical.
Okay.
So they compress.
And tell us why that was necessary or why you did that.
Like I said, you have like a scale that we evaluate for risk. And because she's in bed, not really walking, that's what they do. Our muscles make sure that the vessels are always being squeezed. And she's not walking. She's been in bed. She's sedated. And the fact that she had a central line, all of that adds up into the risk of having clots. So we start that routinely on a lot of our ICU patients.
Is that because of the risk of deep vein thrombosis
Yes.
or pulmonary embolus?
Yes. To prevent.
There was mention made of the exchange you had with Mrs. Kowalski regarding suicide
Mhm.
and her feeling. Did you question her about that?
Yes. I asked her, a little bit, like if she can elaborate more, if she was in distress right now, that we could help her. And then she said, no, I've had these thoughts kind of on and off. Right now, I'm okay.
Okay. And did she express to you that she had a support system available?
Yes, she talked a lot about her family and her church, that she had a lot of friends that were, supportive for them.
Okay. So did you have any concerns at that moment in time about her mental well-being?
Not at that moment.
There was a question asked about the patient, the family's behavior when they came up to pick you.
Yes.
And you mentioned some aggressive
Mhm.
speech.
Mhm.
What are you talking about?
It was Maya being 10. It just really stuck with me because she would curse, saying the F word, and just kind of towards me or the nurses, screaming. At one point, she actually was spitting. So that was not something that we see in pediatrics.
Um, I think that's all I have. Thank you.
Any questions, Mr. Anderson?
That must have been pretty amazing to you that a 10-year-old would drop an F-bomb and other things, right?
I mean, it was surprising, yes.
Okay. How come you didn't put down any of the specifics of that in any of your notes?
I don't tend to put curse words in my notes. I do think at some point, I don't recall where, probably in
Even-
my HMP, I did say that there was aggressive language.
Well, now you're saying that it involves a 10-year-old little girl talking about F-bombs and so forth. You didn't think that was significant enough to describe in your notes?
Can I have a moment to find it? Because
Hey, when I was in the hospital for one of my neck fusions, I said bullshit to the nurse, and the doctor got pissed at me. He called my room and yelled at me. He goes, "You know that word you said, that bull word." I go, "What?"
in my
Spit?
physical
He goes,
exam.
"There you go. You're saying it again." Oh,
Okay.
it's funny.
It's after the abdomen on the physical exam. Very difficult to examine as patient refuses to be touched and mother does not want us to evaluate further unless she's placed on anesthesia medication. Then neurologic. She's very agitated. Eyes are open with intact extraocular movements. No focal weakness. The next period. Very aggressive with staff. Not able to evaluate deep reflexes. I think I just kind of summarized it. I'm very aggressive with staff just because I don't.
But you said
Tend
nothing
to.
about what you testified here in front of this jury, did you?
I just said very aggressive to staff. And to summarize all that, I don't tend to put specific bad language on my notes.
Really?
It's a document, so I
Because
don't.
that's like offensive to you.
Oh, come
It
on,
is
lady.
offensive to me.
Can we? Yes, I'm sorry.
Did you finish your
Did
answer?
you finish your answer about it being offensive to you?
It is offensive to me.
Okay, can we bring up 2175-004?
Is this in evidence?
Yes.
It's in evidence.
She didn't put it in her notes. Come on now. It got put in my notes, and I'm an
It's
adult.
an exchange of texts.
Judge, beyond scope and relevance, Your Honor, we do our objection to the relevance of this.
Overruled.
Okay. If we could, you had just found out in this, can you see it there in front of you?
Yes.
Okay. And you just found out that Ketamine Girl's mom committed suicide, right?
Yeah, I believe that was a text that let me know about that
Right.
months later.
And then you say, I know we did the right thing, but this is really F and then
Yes.
ellipsis, or star, whatever you call it.
Oh,
Up.
she said the F word.
I feel bad.
Oh,
Yes, I put the little star. It's gonna put in really text that.
But isn't it true? You testified you don't have any remorse for any of this.
Objection, Your Honor. May we approach?
Yes.
did you hear her attorney laugh? Okay, my opinion, I do not like her. Okay, look at, she knows what she did is messed up. And if she said that, that's disgusting. And like we were talking, Sandy, that's a scary thought. They could take your kid like that. But I did research on a couple of the people. But this hospital has done it many, many, many times. I mean, this one guy, he spent 2 years in prison, and they took his kid. Up lives. And it wasn't like the court took the kids. You know what I mean? They pretty much did. I don't know. Well, she said the F word. This lady here in the stand said the F word in a text, you guys. I don't write it in my notes. Yeah, you just put it in a text.
Okay, I'm going to sustain the objection. The jury is to disregard the question.
All right, but you seem to be okay with texting the F word.
To a
Is that
friend.
right?
To a friend. I even put the little stars because I don't like to.
Well, and you talked about venous thrombosis. That's a blood clot in the legs.
Yes,
Uh,
where they usually initiate in the leg. So that's why we target.
And these are like the silent killer that can, in children, break free and travel to the heart.
So actually in children, there's a lot of, kind of studies going on, but there is blood clots do originate in legs, adults or children. But we have had patients that they can break and go to the lungs. The lungs are like sponges, and a lot of the children actually tolerate that. But we still don't want that happening. We try to prevent them.
But they can, if they go to the wrong place, be fatal. Can they not?
They can.
So if Beata Kowalski was concerned about her daughter staying in a laying down, supine, I guess you call it laying down situation, and blood clots going to Maya's heart, that would be medical knowledge you would agree with.
Anybody, including us, would be concerned, yes. And the protocol includes SCDs, we do physical therapy, anything that encourages movement prevents.
And insofar as the amounts of ketamine involved, you have no particular expertise in ketamine, especially at that time, right?
I had expertise, but for different indications. We used it a lot.
How many years were you in practice as of this date, October of 2016?
For critical care. So pediatrics, by then I had probably been off residency for about 4 years.
Off
And-
residency?
For pediatrics, yes. And then for critical care, that was a year. But I did 3 years of fellowship.
All right.
She looks like an angry person. That nobody can confront her on anything.
Nothing further this time.
Anything further, Mr. Hunter?
Very briefly, Ron. The text messages that council showed, were those from your private phone
Yes,
as opposed to the medical record?
yes.
Thank you.
Anything further, Mr. Anderson?
Judge, I'm sorry.
You have another question?
One.
Okay.
Further reference to text messages we talked about.
Are you not entertained?
5, 4, 3, 2, I let one go.
Your Honor.
Any further jury questions?
What the heck is going on? So she's the type of person that you cannot confront on anything or have a discussion. And I would hate her to have taken care of me. Me and her would have gone rounds. Okay. This is my opinion. Also, it seems like They did not like this little girl. They did not like the mother. Okay. But I do want to say, like you said, no, nothing can replace her mother. They ruined her childhood. Okay. That poor little girl. However, did they think about her culture? Because she's not from America, United States. Their culture and how they are different. They got that straight face. They don't show emotion. You know what I mean? They're really aggressive. Just saying. Just saying. Yeah. I don't know. I don't know nothing. I'm just speaking. Yeah. I'm no doctor. I'm no attorney. Yeah. I don't like that lady, though. I don't like her attitude. It's the wrong time for her to have an attitude, ain't it? I don't put those swear words. Like I was telling you, Sandy, my doctor called my room and yelled at me for saying bullshit. He goes, "You know that word." I'll say it again. Bullshit. There you go. You said it again. And then I had a nurse come in and have my back because they know that I'm sweet as can be. But I just woke up from anesthesia from a neck fusion. Come on now. I can say bullshit if I wanted to. Come on. I was just coming out of anesthesia and she's trying to get me out of bed. Are you freaking kidding me? You're kidding me. I got up anyways, but still, because they wanted me to sit up in the chair and eat. Don't stop running your mouth. Oh, only if you people knew. Okay, I am who I am. Okay, there's nothing fake about me. Okay. Except for I am more aggressive at home. Okay. I'm loud. I say what's on my mind, but I listen to what other people say too. And I'm not mean to anyone. But thank you for that, Sandy. Appreciate it. There they go. They're arguing. So today is the hearing for Richard Allen in the Delphi case. And if you didn't read my community wall, we can't live stream it.
Okay, Dr. Tepa Sanchez. Is it normal between coworkers at Johns Hopkins All Children's Hospital to discuss patients as nicknames such as ketamine girl or other nicknames?
Whoa.
We don't, if we're doing it over our personal phones, if we have to, or we do, we don't like to put their names. It's an identifier. So we would maybe use a diagnosis or something that
how about
would
a room number?
make sure that the other person receiving the text could recall who the patient is without having to go into much detail.
How about a room number?
Next question. Did you observe
Roll their eyes.
dystonia in Maya's feet?
To be honest with you, I don't recall
course
seeing
not.
dystonia. It was a lot of movement of her legs, and maybe there was some inward deviation that I might have kind of described on the physical exam, but it was very hard to do a full physical detail exam. So I can't tell you with certainty if I recall exactly what I saw.
Did you apply SCD?
Yes, I ordered them, and the nurses is actually the ones
What-
that apply it.
What date and time?
Let me recall. I'm sure you can go back and see at some point in the records what the orders were, but
I am totally
I believe it was on the 8th.
Totally. About this doctor.
This sounds
is
excruciating for
Beatrice Sanchez.
CRPS. What was Maya's reaction?
I don't recall if they were actually placed, and I didn't recall having a discussion of how that she was feeling with them. It was ordered.
Next question. Did you document Beata's comments of death and going to heaven? Or sorry, you did document Beata's comments of death and going to heaven. Did you also point this out clearly to Dr. Sally Smith during your October 8th after your rounds phone call to Dr. Sally Smith?
I don't recall talking to Sally Smith about that a specific point.
Are you the one that said, quote, learned today, end quote? If not, do you know now who said it?
On the text messages, I'm assuming?
I believe that's what it's referring to, yes.
No, I didn't. I received that text.
You testified after Maya left your care about October 8th, you had no further contact. But it appears by private text messages you were, quote, keeping up, end quote, on patient Maya. Is that correct?
No, first of all, I took care of her until the 9th. That's a Sunday. And I would have to see the messages because I never took care of her, and I don't think on the messages it says anything of that sort.
Would seeing the messages help?
Yes.
Okay, go ahead and put it up, please.
So I'm the one on blue if you guys are seeing it. So I don't say anything there that I
Okay.
saw her again.
Thank you. Mr. Hunter,
Very briefly, Your Honor, about to put the text message up again.
is this going to go more than like a minute?
1 minute.
Okay.
So I'm trying to find the text message. The entry learned today is not you, is that correct?
Learned it? No, that's not me.
That came to you?
That
not-
came to me.
Okay,
I am on blue.
very good, thank you.
Anything follow-up?
Dr. Tippett, did you say that doctors at Johns Hopkins are not allowed to use the patient's name outside to protect their identities?
We don't like to use our patients, like, at least me.
Well, I think you said doctors, didn't you? Plural,
I don't like
doctors
to.
there?
I think, I'm trying to use my common practice and say, I can try to generalize, but I don't know what others do. I'm saying the reasons of why.
I'm sorry. Can we bring up 2116001? Do you know Dr. Dees?
I do know Dr. Dees.
And she was
Your Honor, I object to him asking this witness about what other doctors are doing.
Sustained.
I'm not a judge, it's just for the use of the name.
Well, Dr. Tepa Sanchez isn't a part of this text exchange, right?
No, it was
Okay.
directed towards
So-
all doctors.
Sustained. Anything further from the jury? Okay, seeing none, members of the jury, I hope you have a wonderful lunch. I'm going to ask that they be back at 1:30. Do not discuss this case amongst yourselves. Do not do any investigation and receive no information.
I don't know if they're going to speak to the attorneys. I don't like that doctor. I would not want her caring for me or my loved ones.
Okay, the jury's out of our presence. We'll be in recess until 1:15. 1:15.
All right, we're in recess.
That's a long recess. All right, let me look this lady up. Let's see. What can I find about her? I'm just, being nosy. 'Cause that's what I do. Oh, okay. Did I spell her name right? Hold on. Oh, sorry, we don't want to look at that now. Here, we will look at Maya and her mom. Give me a minute. I'm trying to find something. Oops. Sorry. Okay, I haven't found much yet, but let's take a look. You guys can look with me. All right, so here we go. Here she is. Okay, that's how she spells her name. I was writing her name wrong. That's her expertise. Pediatric or pediatric critical care medicine. And she likes to swear in text messages and give children at Johns Hopkins nicknames. Degrading nicknames, I must say. Let's see, her background. Oh, what is she married now? Huh, okay. Okay, she's been a staff at Johns Hopkins since 2016. She earned her medical degree, let's see, Venezuela. Oh, she came from far away. Wow. What else has she done? Okay, General 2012, 2016. Oh, that's insurance. We don't care about that. We just want to know who she is. Okay? Let's see what else I can find out. But I was spelling her name wrong. I will find something. You guys know that, right? Mm-hmm. Yeah, so she's got two last names. Why does she got such a long name? I'll never understand that. So, from my understanding, I could be wrong. People can scrub the internet of stuff about them. Has anybody heard about that? Can you do that? Interesting. Don't worry, people. I will find something. I will. Maybe not right now, but later. I'm going to look into her world. So let's go somewhere else. See what we got going on here. Hope everybody's having a fine day. So, like I was saying, Richard Allen, whoa, Richard Allen's hearing is today because a podcast, Murder Sheet, got an email with the crime scene photos. Can you believe that? And from my understanding, allegedly, it's Richard Allen's defense team. It was a lawyer that was working and no longer is working on defense. That's interesting. So that's at 2, but we can't live stream it. But what Fox is doing anyways, Fox Channel 59, at 2:30, they're going to start, I don't know. After it's over, this is what I know. After it's over, they're going to put it out there for the public. So I don't get it. Hey, Sandy, you're still with me. Wonderful. All right, I'm looking up stuff. What did you think of that doctor, Sanchez, Beatrice Sanchez of Johns Hopkins? I was asking for, for a friend. That's all. That's all. You know what? If you've ever watched any of my videos of this trial, okay, because I don't do it all the time, I looked up a lot of people, okay? Yeah. Who's that one? Shelly? Is her name Shelly? I can't. Sandy. Yes, Sandy. Sandy and Dr. Sally, whatever. That's who I looked up. And all the years of them taking away children from their parents, accusing them of abuse, neglect, of having Munchausen. Yeah, people even did jail time, prison. And they've had a lot of bad stuff happen. There's been a lot of deaths there. Just saying. So I went in really, really deep. I don't know. All right. I know, right? Did you see her attitude? That was horrible. That was horrible for the defense. Their witness sucked. Let's see. I'm looking for something. Hold on. Hey, Tennessee Poppy, how you doing? Okay, somebody just made a comment. I just noticed on my community page. So what I need to do, I need to bring up this. real quick about the Delphi case, the hearing. I got to see if I'm wrong. And I'm not wrong. Listen to me, and I'm not wrong. All right, you guys. So, hey, and if I was wrong, I would have taken it down, okay? About the hearing is today. Okay? So I'll just read this part, but I mean, you can go to any of these here and they tell you. Okay, the next hearing is for Thursday, October 19th at 2 p.m. at the Allen County Courthouse. Okay? So there you have it. It is today. Is Delphi? Oh, Jesus, I don't even want to say it. Hold on. I want to know their time zone. Anybody know the time zone? Time zone. All right. Oh, they're Eastern. I'm Central. Oh. Oh, they have two different time zones. Central, okay, including Bowling Green is Central, while the eastern half, including Louisville, Lexington, is Eastern. Why does it got to make it so confusing? Why can't we all just have the same time zone? I don't get it. So, let's see here. What's going on, you guys? Oh, hold on. I found something. Okay, here I found it, you guys. We are going to look at a video I did on Sandy. Yes, Sandy. All right. Here we go. Get ready for it. Okay, I've been watching Maya Kowalski trial. Okay, it's a new one for me. All right. Now, if you don't know the story, they did a Netflix thing on it that can explain it better if you want to watch it. And it's called Take Care of Maya. Now, I was wondering, how did this little girl get taken from her parents? And the way it was done. Okay, well, it is John Hopkins Children's Center. Okay. They accused her mother of Munchausen. In the meantime, this is going on. All of a sudden, they cut off visits with her mother. Next thing you know, it's the phone calls. Next thing you know, her dad can't. Next thing you know, she can't have a phone in her room. And they isolated her by herself. She's 9. How old was she? 10 years old, you guys. So this lady here, I'm going to show a couple things, but this lady here, main culprit right here. Her name is Kathy Betty. Okay. Now, what's interesting about her, she's had charges in the past. What she has, she told Maya that she could be her foster daughter. Well, here to find out, this lady had a nonprofit with DCF being a foster parent. Now, she's been charged before for felony abuse of a child. Okay. She grabbed a little kid by his head. He fell. Then she put his knees on his chest, and there's another child. and I'm just going to say allegedly to be safe for me. So I'm going to be doing more research on her with documentations, because do you see where I'm going? What the way they did this with Maya leading up to it, and here you go, this mother or this lady here is a child abuser. A foster mother tried to take her. Okay, people, now I'm gonna go over, let's see, oh my God, like 10 that I came off right away of lawsuits, okay, that they have lost, Johns Hopkins Hospital. So let me get to it. I would show proof, because you guys know I do show proof, but StreamYard's being really, really slow. Okay, here's one. All children's hit with the wrongful death. Another lawsuit. What year is this? What year is this? Hold on. 2018. And this is what happened. Somebody was getting treatment at the PIC unit at the Heart Center. And this child ended up dying. Okay. I'm not saying their names or anything, even though it's online. Maryland family files lawsuit against Johns Hopkins. Allegedly neglect led to their 2-year-old twin's death. Yep. This is all public information, by the way. I do want to say that. Then here's another one. Johns Hopkins Hospital. Another wrongful death. Okay. The one in Tampa, by the way. Jury awards family $55 million malpractice suit. And they lost. Or who did they lose here? So their 2-year-old, something happened with the 2-year-old. Oh, they didn't do the C-section in time. And it's like he's a 4-month-old. Okay, another. There's a thing with Johns Hopkins Hospital and Sibley Hospital. Health systems settle allegations of improper comprehension arrangements. So look that up. That's on the government website, the U.S. Department of Public Affairs. Another one, Johns Hopkins pays out $40 million. Yep. Feds say Johns Hopkins, all children, puts patients in jeopardy. Now, this is the biggest one, and this came out in 2019. I will be sharing that one. Okay, here's another one. Hold on. Oh, shoot. 2 mental health workers are in jail. No, I'm going to go past that one. Medical practice verdict against, oh, never mind, you guys. It's another $55 million. This one here got me. Hospital agrees to pay $190 over recording pelvic exams in Baltimore. 7,000 women. He wore a concealed camera. What? And then 2 more families are suing them right now. My God, you people. This article I'm gonna talk about right now. This is filed in 2019, or filed. Oh my God, listen to me. Feds say Johns Hopkins All Children's Hospital put patients in jeopardy. The feds investigated the hospital in St. Petersburg, said the patients are in immediate danger of patient safety. 9 days to make changes or it loses its federal funding. Identified in January. The clock is ticking, 22 days. The feds could stop paying medical bills for patients. Let's see what they did. I want to know why they were in jeopardy, but I'm not seeing nothing. Pose risk of health and safety concerns. Okay, What do they do? Oh, they're under fire for a high number of child deaths. I'm sure there's going to be more to this, you guys. I'm going to go try to find that interview with that guy that went to jail. I don't know why I didn't have it there. Hold on. I'm going to find it. Shoot, I'm not finding it right now, but I'm still looking. Because when they're on breaks, I was going through and I found it, but I can't find it right now. Hmm. Hopefully I'll find it. Okay, I found a couple things. Here we go. All right, this is about Dr. Sally.
My baby! You may not have babies, but I carried my baby for 9 months. This is normal. You don't care. Yes, I did all the baby. You don't care.
Dr. Sally Smith in St. Petersburg, Florida, is the wicked witch that is responsible for tearing apart families. Now, when you are Black and your children are taken away, it is very unlikely that they will be given back to you. This woman needs to lose her license because she has done this to other families as well. This is one of the families that Sally Smith falsely accused of child abuse. This is another family that she falsely accused of child abuse. She falsely accused this man of child abuse, and he was sent back to prison. Do not, under any circumstances, go to Johns Hopkins All Children's Hospital because Sally Smith, this is where she goes.
No, I wasn't sure what elevator you were talking about.
Hold on, you guys. Yikes, that's loud. So, yeah, and what's her name? Kathy. I said a different name. I'm sorry. Kathy, the nurse, or no, she wasn't even a nurse. She was a social worker. And that Sally, they worked together. Fostering. Let's see here. There's another one. Hold on. All right, here we go. so sad.
I wish for the amazing new iPhone 15 Pro. Sean.
Do you mean this one, the one with titanium? It's so light, don't touch it. Maybe stealing wishes from the birthday boy is not your best plan. Switch to Verizon and get iPhone 15 Pro on them. What? Yep, and on an amazing network.
And I don't have to ruin any more birthday parties.
Yeah, that ship has sailed. Let's go get you that iPhone. Here we go. Come on now.
Get iPhone 15 Pro, Apple TV 4K, and 6 months of Apple One. All 3 on us. Only on Verizon.
Dylan and Melissa Bright stay playful and positive for their kids. But underneath, they're healing from an experience so painful, they wonder if they'll ever feel safe again. How would you characterize it?
The most terrifying experience that you can imagine.
It started last September when 5-month-old Mason fell off a chair in the driveway.
The next thing I know, I hear him screaming.
Rushing him to the hospital for help, where doctors found a fracture on Mason's skull and note an unusual second hairline fracture with severe bleeding. Doctors at Texas Children's Hospital, specially trained to detect child abuse, raise a red flag.
When he said highly probable for abuse, what were you thinking? What was your reaction at the time?
I was beside myself because I knew at that moment nobody was listening.
The Brights get a second opinion. A radiologist determines the shortfall could have caused both breaks, and a hematologist from Texas Children's Hospital diagnoses Mason with a blood clotting disorder, possibly explaining the excess bleeding. All of this given to Child Protective Services.
Their exact response to us was, we already have all of the information we need.
So they didn't even take it into consideration that it was possible.
That was their exact response.
During the CPS investigation, the Bright children were staying with their grandparents until Mason had surgery and the Brights wanted to bring him home, telling the caseworker,
We are more than willing to work with you, however that may be, but I've got to choose my son first.
But after 3 weeks without any contact from CPS, the caseworker shows up one night to take Mason and Charlotte, heard on this recording.
Calm down.
No, it's my children. I can't calm down.
They were not notified there had been an emergency custody hearing, so no chance to present the second opinion to a judge. Charlotte tries to comfort her mom. Forced to send the kids to foster care. When their aunt was allowed to get them 3 days later, Charlotte had a cut beneath her eye. Mason's crying hoarse.
How egregious was not telling the family about that emergency hearing, not giving a family a chance to defend themselves?
Huge. The case would have been dismissed the next day.
When Judge Mike Schneider finally heard the case, he was so outraged he ordered the state to pay the families $127,000 in legal bills.
By the time we got to court, the kids had been injured, but not by their parents, by the state.
He also blames a system that, with the best of intentions, can be too quick to follow the judgment of a child abuse pediatrician.
CPS seems to be often willing to, once they hear something that meets a certain threshold in their mind, to say, that's it.
A statement from Texas Children's Hospital says the 2 fractures warranted an investigation, but added a referral to CPS is not absolute confirmation of abuse, nor a determination of guilt or innocence.
A spokesperson for CPS issued a statement saying that after the Bright case, they didn't feel any policy change was needed. They simply needed to follow the rules that were already on the books. That spokesperson also confirmed that the caseworker and supervisor that handled the Bright case are still on the job here.
The CPS workers completed court-ordered training, but the Brights want more change.
As horrific as our case was, we're actually really lucky and very fortunate to have gotten them home. A lot of families don't.
Mason has made a full recovery, but the Brights live in fear of every innocent scrape or bump on the playground.
We're still not whole, and it's hard to say that it's over.
Katie, it's a troubling story. So often we hear the opposite, where CPS is under fire for not acting quickly enough.
Exactly, Lester. And our investigation determined that sometimes that pendulum can swing too far the other way, resulting in parents being falsely accused. So if people want to hear more about this heartbreaking story and others like it, we do have more information.
In the U.S., authorities tell NBC News the war has opened the door to extremists looking to incite violence, with one official warning of a heightened threat environment. Let's get.
Okay. How sick is that, you guys? I'm trying to find that dad that went to prison. And they're right. A lot of them don't get their kids back. I don't know why I can't find it. What's this one? Nope. Everything is about Maya right now. Okay, if I ended up finding it, I will share it. But I'm gonna go for now. I'm gonna be back later. So Sandy, thank you for being here. And you too, Tennessee, and whoever else.